When you're living with a serious illness and hospice enters the conversation, it is common to hear some strong opinions from your doctors. You'll have some telling you to stay away from hospice, keep fighting, and others telling you hospice is awesome, full of puppies and rainbows every day, and you should totally sign up. But you just want to know, is hospice the right next step for you or not? Well, this is your video. I'm going to give you some guidance on how to get key contextual information from your doctors, how to integrate that with what matters most to you so that you can feel more confident about whether or not hospice is right for you. Let's do this. So what exactly is hospice care? Well, hospice is an insurance benefit that you can elect at any point. At least 2 doctors think your life expectancy is under 6 months if your main illness runs its natural course. By using this insurance benefit, you have access to a multidisciplinary team of docs, nurses, social workers, chaplains, and more, all working together to make your time as good as it can be. You also get coverage for medications to manage any symptoms that might pop up, like pain, shortness of breath, anxiety, and you have access to medical equipment like a hospital bed, oxygen supplies, wound care supplies, anything else you might need in your day-to-day. And most of this care is actually provided in your own home, although in some cases hospice care can be provided in a facility if that makes more sense. And though there are some exceptions here, generally speaking, by electing your hospice benefit, you're agreeing to give up any treatment focused on curing your main underlying illness. So you may be hearing that and saying, okay, yeah, that sounds pretty nice, but I'm not sure hospice is right for me. Giving up curative treatment, well, that's kind of anxiety provoking, right? Who wants to give up curative treatment? At this point, you have to pause and ask yourself, have your doctors given you all the information that you need to really make this decision? I'm going to give you a question to ask your doctor, and you're going to need to listen for 3 key details in the answer that you get in return. So the question to ask your doctor is this: what would the path forward look like if you did not do hospice? And the 3 key details you're listening for and digging for if you're not getting them are: 1, what treatments are being offered as an alternative plan? 2, where would those treatments be given? And 3, what would the impact of those treatments be on your life expectancy? So let's walk through those point by point. First point, what alternate treatments are being offered? The reality here is that once hospice is being brought up by your doctors, they may be worried that continuing your current treatment plan may hurt you more than it helps you. When time does start to get short, even treatments like IV antibiotics and IV fluids can do more harm than good. There comes a point when the risks of treatment are so high and the potential benefits so low that doctors may not even offer those treatments anymore. So it's helpful to establish with your doctor, are there any other treatments on the table at all? Are you really leaving anything if you choose hospice care? Now, point number 2, where would that treatment be provided? Now, depending on the seriousness of your situation, continuing disease-focused treatment may have implications on where you spend your time moving forward. The more complex your illness and the more complex the treatments for it are, it increases the odds that the treatment that you're getting may only be able to be given in a hospital or like a nursing home setting. So if you're someone who really cares where you spend your time moving forward, this is an important detail to have. And last point number 3, often the hardest point, how would these other treatments impact your length of life? This is a hard one to ask because no one wants to feel like they have a timer ticking over their head. And it's also hard because docs really struggle to talk about life expectancy in a helpful, meaningful way. So I do find it helpful to talk about ranges to at least make sure that you and your doc are in the same ballpark. So you might ask your doctor, hey, how much time are we talking about with this other treatment? Am I buying days to weeks, weeks to months, more than that, less than that? And see what they say. Once you've got this information, now you need to pause again and reflect on your own goals and priorities. Having heard all this from your doctor, what does matter most to you? Where do you want to spend your time? How important is it that you're as comfortable as possible for that time? Versus how important is it that you try to do everything you can to live as long as possible? And as you think about these things with that information you got, hopefully you're getting a clear sense of whether or not hospice makes sense for you in terms of how it will support your priorities. But I also encourage you to tell your doctor what matters most to you and see what they recommend. So I really hope you find this process helpful and that it gives you just a little bit more peace of mind about whether or not hospice is the right next step for you. Thank you so much for watching, and thank you for doing the hard work out there.